I'm Reverend Tim McDonald, co-chairs of the Grady Coalition and pastor of the First Iconium Baptist Church. Coming today to express our sincere and deep concern regarding the conflict of interest on this new Grady Board. We're standing in front of a sign with the name of Mr. Cousins. It's highlighted for leasing of a building that we feel is in direct conflict with Grady Hospital. For a number of years, it has been alleged that many of the paying customers who have gone to Grady have been transferred here to Crawford Lawn.
That's right.
To have Mr. Tom Bell, who is one of the vice president of Cousins Properties, as a member of the new Grady Board, we think is a direct and blatant conflict of interest.
Blatant.
And we are hopeful that Mr. Bell will acknowledge this conflict and will do the right thing. And the right thing is for Mr. Bell to recuse himself and to resign from serving on the new Grady Board.
Right now.
This will provide opportunity for this board to be fair and impartial. As it stands presently, there are others on this board who we think, with connections with Emory University and with Children's Healthcare of Atlanta, who have potential conflicts. The citizens of the state of Georgia would be better served if we don't have these conflicts. The patients at Grady would be better served. The workers at Grady would be better served.
That's right.
If we don't have people trying to play one interest against another interest. And so we, the Grady Coalition, are standing in solidarity, pointing out these conflicts of Cousins Property and Tom Bell. And in addition to that, we are saying, where is the money? We are saying and believing that the initial agreement signed by the Grady Authority says that there will be no new board if the money is not there. To date, there is no money from the private sector. There is no money from the Georgia General Assembly in the 2009 budget. Indeed, there are conversations, but there is no money. If there is no money, there is no deal. If there is no deal, there is no new Grady nonprofit. And so we are hopeful that the priority will be spent on the patients who depend upon Grady, on the workers who work in the Grady healthcare system, and Tom Cousins, Tom Bell, and all of the others who have blatant conflicts and even potential areas of conflict should recuse themselves, should resign from the board, so that we can get impartial people who will have Grady's patients' interests as primary, who will have the workers' interests as primary to secure the future of Grady Hospital. Senator Vincent Fort has been a stalwart fighter in the General Assembly, fighting for funding for Grady, fighting for the rights of the workers and the rights of the patient, serving also as co-chair of the Grady Coalition. Senator Fort will come now and make a statement.
All right.
Thank you, Reverend. First of all, let me say, shame on Tom Bell. Shame on Tom Bell. Because he's putting his own self-interest before the interests of poor people who need health care in Atlanta. He's putting the interests of his company before the people who need health care.
All right.
If Tom Bell really cared about Atlanta, really cared about Grady Hospital, he would step down
Right now.
from the Grady Board right now.
Right now.
Not tomorrow,
Not tomorrow.
not next week, but right now.
Right now.
Because the conflict of interest deprives him of the ability to make decisions based on what's good for Grady. We need people on that board who make decisions based not on what their self-interest is, not how much money they can put in Cousins Property's pockets, but on what is best for poor people at Grady Hospital. It's ironic that over at the state capitol, the idea of an oversight committee has been dropped. When Grady was controlled by a diverse board, an inclusive board, African Americans, white.
That's right.
We needed an oversight committee, but now that it's been taken over by Tom Bell and the Chamber of Commerce, that's right, Reverend. Now that it's been taken over by the Chamber of Commerce and Tom Bell, they don't want no oversight. They believe that the only oversight they need is their own oversight. Well, we know that power corrupts.
Right.
And absolute power corrupts. Absolutely.
Absolutely.
And Tom Bell has put himself in a posture of corruption. And now they've even did a trick on us.
A trick.
When they talked about conflict of interest law, they said that will be for board members who come on the board in the future.
In the future. Yeah, right.
Not now.
Whoever at the point.
So we've been tricked. We've been had bad.
Bamboozled.
Bamboozled.
You're wrong.
The Reverend is right.
And you were right.
You know,
I'm right.
we were told Grady would get money for poor folk from the state.
Right.
Guess what?
Right.
The money
Well, the money
that the state they
give.
give cannot be used for indigent care.
Right.
I'm out.
So we've been
Thieves.
had real bad.
They thieves.
So we come here today in solidarity,
Right.
the faith community,
Right.
elected officials,
Right.
activists,
Right.
the homeless, patients at Grady to say
All right. Listen for you.
that Tom Bell resign now. This
Right.
is not going to stop. We're going to maintain our watchdog status on this
That's
issue.
right. That's right. Very good. Very good.
On this coming Monday
Yes, sir.
at 2 o'clock,
Right.
April the 7th,
Okay.
this new Grady Board will be meeting
Right.
at the Loudermilk Center.
We'll be
I
there.
promise you that the Grady Coalition will be there to share our concerns regarding the conflict of interest, to share our concern regarding the lack of money for the patients, for the hospital, and for the workers. And we certainly solicit the support of the community as we continue this fight. We are marathon runners. The Grady Coalition is in this for the long haul,
Yes, sir.
and we will not stop until Grady Hospital is solvent, that there are monies there continuously from the state and the private sector to continue the viability of Grady Hospital, not running annually in a deficit, but becoming the kind of hospital that serves the poor, the uninsured, and the underinsured, the homeless, the indigent, and those who have been locked out and left behind. We thank you for the Grady Coalition, for its stance, and Mr. Cousins, Mr. Tom Bell, and others on this board who have conflicts. Do the right thing. Do the right thing. Resign, make room for impartial new directors to serve on the new board so that the interests of Grady will be paramount and the interests of the patients and the workers will be addressed. Thank you so much.
Thank you.